Welcome back to the Advancing Healthcare Innovation Show. I am your host, Michael Stamatinos. And if you're new to us, welcome. It's great to have you here. We're super excited because we just have some amazing conversations with real leaders that are truly trying to reshape the future of healthcare. We're really passionate about a few different areas. We're passionate about access, about innovation, about leadership, and about the adoption of these innovations. And if it's your first time tuning in, let me just sort of take a quick step back and just kind of give you the lowdown a little bit more about what we're really trying to get done here. So our focus is bringing, real stories of innovation and leadership to life, not just the stuff that you read and all the little wins, but really a lot of the learnings. And our aim is giving, the leaders that are coming on the show to be able to sort of share this and give them the space to share their story ultimately with our community and ideally with the world. So we've got an amazing action-packed year. If you haven't had the opportunity to check out any of our historical interviews, however you're consuming this, if you're watching it or if you're listening to it, please hit the subscribe button now so that any of the new episodes come directly to you. So today's guest is Aidan Hettler, the CEO of Sedgwick County Health Center. So Sedgwick County, I can't say that 10 times in a row, but Sedgwick County Health Center is a
Nailed
critical access county-owned hospital,
it.
which
Mhm.
means that the hospital isn't just part of the community. It is the community. So
Mhm.
it's one of the largest employers, it's the safety net, and in many cases, honestly, it's the reason why families, can stay where they live. So Aiden runs a hospital where, nothing is really abstract. If staffing is short, or if nurses call out sick, I mean, you feel it the same day. If
Mhm.
volumes drop, it shows up quickly. If trust is lost, everybody knows. So Aiden is really casted now where he's got to lead with a high degree of precision, discipline, and judgment. So when people think about rural healthcare, it's not a smaller version of sort of big system healthcare. The rules are different, the trade-offs are real, and honestly, there's just really no place to hide when decisions go sideways. And this conversation is really going to be about, leadership, what it really actually looks like when resources are limited, and accountability is very public, and the stakes are absolutely personal. So no buzzwords, no theory, like real life stuff. This is just how it works. So, Aiden, it's great to see you. Welcome to the show.
Yeah, thank you so much for having me, Michael. I really appreciate the opportunity to come on.
All right. So before we talk about like, how you got into it, walk me through like a normal, Tuesday morning for you. What's like the first problem you're dealing with but before 9 a.m.?
Oh, that's a great question because I don't think there is any normal. Every single day is something dramatically different. I mean, I've had everything from the phone calls that the night shift nurse in the nursing home didn't come in and the day shift nurse didn't come in and the night shift nurse is still here and there's nobody else to call, so you need to figure out who to call. And it's me sitting at the nurse's station desk reaching out and doing every single thing I possibly can to find connections and find people to come in and relieve the nurse who's now past her hours. So a morning like that, we could have a morning where a washing machine breaks in laundry, or there's a piping issue in dietary, or I mean, you name it. It's anything you could conceive of. I don't think anything is off the table. This role has taught me and shown me a lot in the last 3.5 years. And there's no normal. That's a good thing. Keeps you on your toes and keeps
Definitely.
you dry. But yeah, it's been great.
Awesome. I mean, listen, when people think, here, hospital CEO, my hunch is that they imagine authority. In
Uh,
your world, what does like authority look like,
mhm.
day to day?
Yeah, so that's a really awesome question, especially for someone my age, because it's not so much about authority. And I think people think of all healthcare CEOs just in this blanket light of, oh, they're, in the ivory tower and they make all this money and they make decisions that they don't care how it affects people and this, that, and the other. And um, in rural healthcare, like so many of the points that you made before, eyes are on you always. Every move that you make, every decision that you make, there's, opinions and it has real impact, and you feel that impact because you're so much closer to, the patients, to the staff. It's just dramatically different. And in terms of like authority, um, I became a CEO at 22. And, people don't take the authority approach super well, as you can imagine, from someone that age. And fortunately, that's not really
What
my
was that
style.
like? Somebody looks at you, they see a young buck coming in, and maybe this will be an opportunity for us to kind of talk about the unconventional path that
Yeah,
you kind of took to get, I'll call it, to get into the seat, because people work their entire careers to try to get into that seat, right? Maybe they have aspirations of that,
right.
and you were placed into that seat um, earlier than most, I'll say.
Mhm.
Talk about the unconventionalness of the unconventional path of you getting into that seat.
Yeah, so I originally left uh, college, my undergrad experience. I came out with a degree in supply chain management and just general kind of business management stuff. I started at Lockheed Martin. I had an amazing, role there, was really enjoying everything. And my role was remote. And at the time, I had found myself living and working in Julesburg, which is where our health system is based. And like I've shared with you in the past, small towns, everybody knows everyone and everything about you.
Yeah.
So they knew first off that I was Aidan, the guy who's not from here, but he works in business. He works at Lockheed Martin. He this, he that, the others, all that. And eventually there was an inquiry one day from the marketing director at the hospital, and she said, "Hey, we've heard of you. We know you work at Lockheed. That's really great. You must be a smart guy. All the flattery, and we have an opening coming up in our CEO role. How would you like to take a crack at that?" And absolutely, without hesitation, I said, "No, thank you." I'm flattered. I really didn't think it was the right role for me. I had never ever considered going into healthcare. Um, it hadn't been my pathway. I was in supply
Mhm.
chain management. I did contracts administration at Lockheed Martin and really enjoyed that work. Never really
Yeah.
thought take any leaps, especially not that soon after just starting there. But through a lot of really good conversation, I found that being a healthcare leader aligned pretty deeply with my personal values, doing the work to take care of people, impacting my community,
Right.
and just a lot of things that really resonated. And what I did know in my career is that I absolutely wanted to be a leader. I really um, gained so much from filling others' cups and making sure that they have what they need to do their best work. And by doing their best work, they're going to do best by the patients.
Yeah.
So,
Did you
you know,
know? Did people see early on they were like Aiden's different? Like he really is a leader. Were you always seen as a leader, even growing up earlier on?
yes, yes,
Okay.
I was always that guy, in school that would raise his hand. Yeah, I'll be the project leader. Yeah, I'll do this. And I really liked it, and it wasn't just for the sake of going back to this authority conversation. It wasn't for the sake of like, I gotta be the guy to do that. I never really even wanted that. I would have been more than happy to just be the worker. Um,
Yeah.
but when this opportunity came and the ask came for me to do it through, a lot of reflection and again, discussion, like I mentioned, I came to realize that obviously this is an awesome opportunity, very unconventional, very fortunate for someone my age to be extended such a invitation to even apply, let alone sit in the seat permanently. Um, but I realized it would be really great. And it was a lot of what I had hoped to do, impact people, whether indirectly through our care or directly through my team. And it was great. And eventually, I went through the interview. It was, kind of unconventional. It was a big panel interview, 17 people in there, our whole board, all the department managers. And so, I mean, everything was unique from the start. And that's really what's so great about it. It's great that the interview was that way, and I got to interface and have the dialogue with all of the leaders of the organization so that they could see me for who I was and what I could bring to the table. Because what I could bring wasn't, a deep healthcare bench of skills and knowing revenue cycle and knowing, rules and regulations and laws. And I didn't know any of that. But what I did know, um, at least I felt that I knew really well, was that I could connect with people and hear them and listen to them. And above all else, that was what the organization really needed at the time. I was the fifth CEO hired in a 5-year period. So that's obviously a good amount of turnover. And
Yeah.
rural healthcare is not easy on anyone, especially being in the hot seat of the CEO. But I felt like I could be someone who could at least hear, everyone and understand them and work with them to make meaningful progress. And getting back to that authority piece, I said I lead diplomatically, in a democratic style. We're going to crowdsource opinions and input, because even if you think you're making a decision for one department, it's really going to affect so much more. It's all interconnected and intertwined. So I never wanted to be the sole authority who was like, yes, we're doing this unilaterally and no discussion about it, because it's not in my ethos. It's not who I am. But I
Yeah.
also fundamentally believe it's a better way to lead, because then if you move forward with something and it doesn't go well, you can fail forward as a group. And you knew that as a group, or at least a majority, we decided to do this together and we're going to own whatever the outcome is. And that's okay.
Mm. So then what really kind of you get into the seat, right? You
Mhm.
do you have like a board of advisors that you get to go to, confidants that can support you and help you on the day to day? Because if you haven't done the job, right, but they feel like, all right, this guy can connect. How do you leverage that in terms of
Yeah, so my
uh,
board was pretty insightful and helped, give some structure. My board of trustees, that is, since we're a county owned um, health system. And they said, we want you to find a mentor. And I found that in an amazing guy named Kevin Stansberry, very highly regarded and respected in rural healthcare, I would say across the country, just an amazing person, heart of gold, and was willing to take me under his wing and be that confidant for, the 5 a.m. phone call of, oh my God, I can't believe this is happening. I think this is what I should do. Is that totally crazy? Help me. He was that. Um, and then honestly, the leaders that were in the organization prior to me also, welcomed me and helped me get up to speed in terms of education and the things that I needed to know to operate effectively in this role and help them solve the problems that they face, that now that at that time we were facing together,
yeah.
because I put in there. So
I mean, was there a moment early on where you're like, okay, and you thought, all right, this role is not what people think it is.
um You know, I don't know that I was so insightful then, not my first year, but I looked back after my first year and I thought, wow, I can't believe anybody even gave me keys, in a bad thing. That's
Your first year, you probably aged like 10 years.
Oh yeah, yeah. And it was all just, it was figuring things out as we went, but that almost makes it sound haphazard, but everything was very deliberate and intentional in terms of, you know, working our way through problems and issues. Because when I was hired, the board of trustees kind of had a list of things that they were like, okay, you need to figure out these 5 initiatives, and they weren't small. I mean, they were gigantic things ranging from financial to cultural to, we had a ton of jobs open and had a retention problem and had this and that. And we just started chipping away kind of a piece at a time at those needs, and those needs blossomed into new things that we found out we needed to do. And it's kind of progressed and snowballed naturally ever since then. And we've never stopped tackling the issues, as you can imagine, in rural healthcare and in
Yes.
healthcare in
Yeah.
general. There are plenty of problems to address and tackle.
There's a lot of things running through my mind right now, but I just want to kind of,
I gave you just a
pull.
little bit there.
Yeah, this is, the inner kindergarten person in me is like, oh, how did you do this? How did you do this? But I mean, one thing is clear is you're running a county-owned hospital. That means that there's a lot of public accountability. And you mentioned around decisions and how those decisions impact others. So open visibility, politics, whether you want them or not. Thinking about this, like when you make decisions, did you ever think about like, hey, am I going to be able to like go out to the local restaurant or the place to
Oh
like
yeah.
get food, and are they going to be pissed at me?
Oh yeah.
Talk me through that thinking.
Oh, absolutely. Yeah. I mean, the impacts can be felt everywhere, in the community. And yeah, that's something that you have to live with. I mean, I've been stopped in the local cafe and the grocery store, and it's people who, they know me, but I don't know them. So
Yeah,
they come
yeah.
up and have kind of this awkward interaction where suddenly, they've got me cornered and they're like, I can't believe that you did, X, Y, and Z. And what were you thinking? And it's really hard because, as you can imagine, in a
Well,
role like
what's an example of a decision that you had to make? Knowing that everyone's going to have an opinion. Like, give me an
the
example of that.
hardest ones are personnel ones in a small town because, if you make the decision to cut ties with an individual who's, been in the
Mm,
community forever, people want to know why. And, I don't fault them for that. That's human nature to want to know the why behind things and how could you have done this? And those are always the trickiest because I can't talk about the why, for a million different reasons. Of course,
yeah.
confidentiality, private, all the things you can run through the list. And that's really hard for people to understand because they'll hammer you for answers and they want, accountability for the person that they know. They want to hold you, being me in this case, accountable for that action. And there's really no good resolution there because I'm bound by, the privacy standards and rules, and that's that. So those are always kind of the most difficult because people really want to know and they just can't. And in
Mm,
small towns, that goes against the grain culturally of just how things
yeah.
work.
Yeah,
You know,
it's like high school all over again.
right. And the hard thing is when people can't know certain information, then they create information to fill the gaps on what they think they know happened.
Yeah,
And it's especially brutal whenever they're upset at you
yeah,
and then they start, well, I bet he did X, Y, and it's hard because then you hear about that later, everything spreads in a community and you're like, well, that's what the word is, but in my heart, I know, this wasn't what it is, or people internal.
yeah.
So that those are always hard,
Mm,
um, just because of the restrictions, but they're ones that you're duty bound to keep, and that's
yeah.
okay.
I'm just thinking about sort of I mentioned earlier on sort of the contrast between, urban big systems versus rural. And in big systems, they can pause, they
Yeah,
can, take time, debate. It seems like you don't have that luxury. What
no.
what types of decisions do you have to like make fast that others would,
Oh.
maybe study
You know,
for months?
yeah, I mean, fast decisions come in, several forms, whether it's, you know, getting involved to the degree that I can as a non-clinical person in a clinical decision, with my team, and they need someone to make a call and make it quickly. Those are hard. We're, as you can imagine, operating
Mhm.
with old facilities, that are aged. They've had updates along the ways, but the core hospitals from 1950. Our nursing home is built in 1962, not majorly renovated really since. Even our newest building, our assisted living, was built in 1998. And, you know, that comes with mechanical issues and things that happen out of the blue, and you got to think quickly, and you have no resource. I mean, the resources are really restricted, not just in a financial sense, but to frame this a different way, in my first couple months on the job, it was December of 2022. We'd had a blizzard, we'd had crazy cold. Like, I mean, it was just the wildest kind of start to
Hmm.
the winter that we'd seen in some time. And we had, boiler failures in our nursing home. And these things
Big
always
problem.
happen in the middle of the night, always in the middle of the night. And it was right before Christmas. So I wasn't even in town. I was on the other side of the country visiting family, doing all this stuff. So then you have this moment in your head where you're like, oh my gosh, what are we going to do if we can't get these boilers back online because we can't get a technician to come out because there really aren't any. There are some, but the expertise can be limited within the range of our area. And then, so things just snowball and they cascade quickly. And then you're faced with, do we need to evacuate
Yeah,
residents?
I was gonna say,
And
do you gotta move people? That's obviously
yeah,
can be very
and,
dangerous.
and thankfully we had avoided that in this situation that I'm using as an example. But like we went hour by hour and we're like, okay, what's the status? What are the temperatures? What's safe? How are people doing? And it can be a real nail biter, as you can imagine, because
Yeah,
those happen quick. And once you make them, there's no looking back because you gotta do what you gotta do to keep people safe and protected. So
yeah.
it's
I was gonna, to
I
me,
say,
there's obviously trade-offs. Yeah, how do
mhm.
you sort of explain trade-offs when, like, to a community, especially when, you know, doing everything, like it's not possible, you know what I mean? I mean, how do you explain those trade-offs? Do you have to, to the frontline leaders?
Yeah.
Um, do you explain why you do take certain decisions? Like, tell me about, like, how you communicate that, out to the team.
Yeah, it's difficult because every decision that I make, whether people agree with it or not, they have a nuanced opinion about it, which they're entitled to. It's a delicate balance and dance, especially in these small organizations and small communities, because we have people who demand answers and information and they want their input. And there's a certain level of comfort that you have to have in a leader or as a leader saying, no, we did this because this happened. Like it's kind of like you always have to have your guard up and your defenses because you never know where the conflicting opinion is going to come and what people are going to say. And you almost have to be ready to run it back step by step and say, well, this was the information I had. So we did this and this changed this input. So we did this. And,
Hmm.
so it's very much just kind of being at the ready. And when you make a decision, you really got to defend it. But also, for longer range projects and things, a big thing that I tried to express continually was people also have to be comfortable with us pivoting. Just because we said we're heading in this direction or this is the goal, sometimes that does change because you find out more information along the way. So I've had it
Right,
kind of
right.
be the counter thing where people have said, well, no, you said we were
They
going to
hold you
do
to it forever.
this.
You're like, this isn't that
And
shit still.
now we're not. Why? And I've had to say, well, we hadn't realized this happened, kind of often during our EMR transition, which went really well. But there were so many things that we learned along the way that we would have to change. If we promised nursing that something was going to be connected a certain way and then found out that it really wasn't possible or it wasn't financially feasible, then we have to backpedal and say, well, we can't do this, but now we can do this because these are the resources that we have at our disposal and so on. And you get the picture. So it's
Yeah.
funny how it goes both ways, how that questioning and defense after the fact can change to, offensive posturing when decisions are being made or they need to be changed. So,
Mm. I mean, you talked about, sitting on old infrastructure, buildings, but also technology. Thinking about that and coming from a place like Lockheed, you've got
mhm,
this core list of five tenants that, the list of five big rocks that you need to kind of start tackling. You're
yeah.
in the job and, a year into it. When do you start to really shake things up? Do you initially start shaking things up, or do you wait till you start to have some solid relationships in place until you start making little pivots? Or how do you think about it? Or you think about it from, asymmetrical risk reward, small risk, but like really outsized reward. Take me through your thinking and
Yeah,
what you end up doing.
definitely earth-shaking moves are something that I do not recommend, in small communities and things like that. And the process flow for making big changes are really different from what
Yeah.
people expect. I came from, you mentioned me being in the Lockheed environment. Well, anytime you make big changes at a company like Lockheed, it's like turning an aircraft carrier. You can't do it going a million miles an hour. You got to do it slowly. And, there's a process for this, and you follow chain of command, and you do, everything's the logical kind of flow that they teach you in business
Right.
school,
Right.
process driven, and that's great. Um, in this environment, that is not really the case. For a lot of things, you need to develop what the process is going to look like for the case that's in front of you. And then in terms of big shakeups, I you just really can and need to do everything that you can to avoid those. And this isn't avoidance of necessary change.
Hmm.
This is avoidance of abrupt, culture shocking things that will come back and bite you because, you also have to deal with kind of the lack of having the bully pulpit that people have when they're from the community and, have been with the organization for a long time. As the new guy on the street, you don't have that. So you need to be really wise about
Right.
what capital you do have and the relationships that you've built. And one surefire way to expend all of that capital at once is a rapid fire off the cuff decision that people don't like.
Hmm.
So, or, not necessarily don't like, but they don't agree with, or again, can't know the information behind. So you have to be really delicate with just about any decision. Um, and kind of brace yourself sounds, like it's so like an attacking environment, and it's
Right.
not, but you just need to be ready to state your why and state your case and stick to it and not
Mm.
deviate. So,
And you mentioned also, sort of off camera about, some of the folks that you've been able to kind of pull in externally and get them to look at the broader, bigger mission and vision. Do you use that as a mechanism to recruit? And have you found that to be really sticky? Do people enjoy the fact that it is a small town? People get to know one another. It's kind of got a family feel to it.
mhm.
Talking about enticing and luring in talent that wouldn't normally be. I think it was your CIO that you had brought in, your CTO.
Yeah, yeah. Our CIO, and we have an amazing CMO, and we have a ton of really great leaders that we're very fortunate, to have. And I could go down the list, but yeah, that mission factor is huge because I don't have the ability to entice talent with, big paychecks, amazing benefits, living in, a town that is, ripe with resources and activities and things you can go to do, like the closest target's to over 2 hours away. And we don't have a coffee shop. We will, though, actually very soon, which is exciting. Um, so you really are on it there with, yeah, it does take the stickiness of the mission and getting people to believe it to come and work for us, for people
Mhm.
to recognize that in the sea of, options that they may have for work and careers, we are different, and we are headed in a different direction, and we embrace growing because if you're not growing, especially in rural, you're dying.
Mhm.
And a lot of people really liked that energy, and I was talking to them about joining our team and why they should. And it really worked. When I
Mm,
mentioned that when I started there, we had a ton of open roles. We had a lot of travel staff on our nursing roster and, everything that you could imagine. So it was kind of piece by piece, person by person. Like I can't point to any defining moment of like, yeah, we nailed it right there with culture and now everybody's flooding in. But it was, bringing one person in at a time.
but
They were,
when did you know that you're like, hey, there's something really good going on here? Like, when did you know? Because it was,
you
how much
know,
time was that? Like, was it end of year one, end of year two?
that's an interesting question. I would say at the end of year one, we got an opportunity that came about really interestingly. I guess that's a theme with how I was placed and so on. But we got a call from a local clinician that their clinic practice was being closed by their larger organization. And this clinician asked me, she goes, well, do you think there's any chance after they close it, you guys at Sedgwick County Health Center would reopen it? And I'm really glad you asked this question because I don't think I've ever reflected on it this way, but I would say that I think that was a very pivotal moment where we,
Mm,
as an organization, started to think, yeah, we really can push for more. So we ended up hiring on that clinician. We weren't hiring at the time. It was
right.
really kind of a huge risk, taking and we're talking, our clinician team was six. This was hiring a seventh. In our world, where every dollar matters, that's a really big deal. So you're like, okay, we're going to do this. And yeah, I think we are going to reopen that clinic location. And that marked the first time our, small system had physically expanded in 26 years. So that was a really big deal. And I think that was probably a unique moment that started changing the tide because it was like, okay, we can make big moves because it was a big deal, in our region
Yeah.
that
Well, not
we
only that, but
were,
like it also reinforces the vision. Like, hey, like we're gonna grow.
yeah,
Well, it's one thing to talk it, but it's another thing to walk it and then to back it up. Now they're like, oh, he
yeah,
he really does mean what he says.
yeah,
And like here's proof of it.
yeah. So it was cool. And, it really put the wind in our sails. And mind you, this was such a crazy, crazy, stupid thing to do. Like any expert in the industry would tell you that it was the worst timing for us to take on, another clinician, another clinic, because we were in the middle of our EMR transition. We were planning another service line expansion. I mean, my team, they are a bunch of A-team hitters, that's for sure, because in 2023 and in 2024, all we did was, hit homer after homer after homer because we had to. Like there were just so many pieces in motion that it couldn't fail.
Give me an
Um,
example of a home run.
oh man. Definitely, being extended the opportunity to open that clinic. I know I keep going back to it, but it was really cool that of all that, because there's other small rural health systems in our region, right? Like we're not on an island, 200 miles away from anybody else. Within 50 miles, there's five others. But it was cool that this person reached out to us because they had heard, through communities and things about what we were doing, how we were starting to look different and act different and, do things right. So we were their choice to
Mm.
take over this location and care for this new community that we hadn't previously been in. Um, so acquiring that clinic, having that clinician join us was totally a home run because it opened doors to things that we had never even imagined before.
Yeah.
And, another home run, frankly, was just doing an EMR implementation. Like we did this crazy project, and I know that, systems do EMR implementations all the time, but it is such a fundamentally impactful project. Like we approached it as take everything that you know about your current workflows. You're going to need to put them in a box over here because we are recreating the wheel over here. Like this was our opportunity to right size and adjust processes to make them the way that we wanted to meet our patients where they were and everybody else. So going live in the fall of 2024. It was September 30th. It was like the last day of September. It was so goofy. The finance people hated that because it wasn't say of the month, and I do feel for them there. But it marked a huge achievement because along the way we changed all those processes. We also aligned the right way with a lot of our partners. We found new partners for radiology who are amazing and have completely changed the way that our um, system is able to practice now, and our clinicians are able to get information. We changed our telepharmacy service. So now we have much better access for our clinicians and our nurses to call pharmacy and ask questions. And it was just every single little piece along the way that culminated to, yeah, that was a home run moment because we did all the work, for a
Yeah.
year and a half straight. The team just was grinding through every process flow in the system, and there's always hiccups, and I bring this up anytime I am given the opportunity to chat on a podcast because I think some people listen out there and think everything goes right all the time, for these people that are
Oh,
being
that's
and have
they're living in La
success.
La Land.
Exactly. So I think it's important to say, like, yeah, today we're on the EMR, it worked, still works, and we're still making fixes, and that's okay. So I just like throwing in that plug because I don't think we ever talk enough about, yeah, well,
Yeah.
we tripped and stumbled and fell forward here, and that's okay, it happens. So it's all the mark of progress. But yeah, those are some examples of home runs and when the tide really started to change, I feel like for our culture, because it was energizing to do these massive, massive things all at the same time. But we achieved them and it didn't break us either, which was really cool.
If anything, do you feel like it galvanized the team even more now?
Yes, my CFO and I have actually recently talked about this a few different times of how that period of time, I think everybody rallied so well. I mean, and it was like kind of in perfect harmony. I don't know that there was anything that's ever united them. And I know this is coming right out of the pandemic, but this was like a positive unification point of like, yeah, we are doing this together. It impacts everyone and it's going to be great.
Mm, yeah. I'm even just thinking about some of the other things that you mentioned around areas around revenue cycle and look, no money, no mission. We've heard about that numerous times before. You went in, you changed, the infrastructure. You talk about how delicate finances were. Oftentimes I see that the most innovative organizations are the ones that have, really great financial like res restrictions, but they somehow find a way.
Mhm.
Was it more around the lines of, hey, we can't afford not to do this? Was that sort of the business case? And then how do you then do that in terms of, well, what's next? Well, what's the other big rock? Because you said there were five things, so you clearly updated the infrastructure. What were some other things that you're going to
Yeah,
try to
so
get done?
I mean, some of the quintessential issues were when I started, the organization were in a state of, quite big financial strain because there were a ton of losses at the end of 2022. So it was this really big inflection point of we've really got to get this right. We don't know how exactly we're going to get this right, but this is a cannot fail kind of mission to produce really like a financial turnaround.
Mhm.
So it was just chasing, recovery and expense reduction everywhere we could, but not expense reduction at the detriment of our people. The people always came first. So in the first year, when we were focused on, reducing the deficit that we had from the year before in the present
Right.
fiscal year,
Right.
we simultaneously increased wages, reviewed benefits to make them better. We did all of those things because I firmly believe and, pushed this idea, into the minds of my team. I was like, if we take care of the people, the other factors will come together, you know. So don't worry about cutting corners at the expense of people's wages, livelihoods. Those that will never get us there. So it goes against conventional wisdom to invest whenever you're also trying to reduce such a deficit. And I
Yeah.
know there's plenty of great leaders out there who know that and do the same thing, but that was a huge part of what we did. So we chipped away at that financial aspect. Our nursing home was also kind of in rough shape. Right before I had arrived, we had a state recertification survey. Did not go well. We got some immediate jeopardy tags, and if you're familiar with those are very
Mm,
serious.
yeah.
Um, and we were being looked at, by our state organization as a potential place that may not make it.
Mm,
So that was on the list too of like, you got to turn around the nursing home and figure this out, and we still have some struggles today like with volume, but the thing that we did get right in the last 3 years was getting the right team and people in place.
mm,
That took a lot. It took a lot of trying out different leaders in the space, and not all those worked. I ended up hiring 6 DONs in 3.5 years, and on its face, people are going to say, whoa, that's crazy. What is your problem? What are you doing to these people?
mhm,
How are they not making it? But it it took that level of turnover to find the just right person who now is like the biggest rock star there and has helped us achieve all the other pieces. Like we struggled with staffing the whole way until we got this DON. And last year, we were able to mark for the first time that there were no travel staff in the building in over 5 years, which is great. So again, testament to like the right people, getting them there. And you're not going to get it right the first time every time. I certainly
right.
didn't. It took 6 times. But that was a huge part of turning around that service line from a safety standpoint, a quality standpoint, and candidly, we're still working on the financial standpoint, but I do believe that that is going to come. We've got plans that we're working on and all the things, but there was no way that we would ever be able to even begin tackling the financial aspect of that service line until we had the people right. And we're there
Yeah.
now, which is great.
I mean, you said it. Look, when pressure stacks up, I'm curious, what habit or practice do you have that keeps you grounded, and do you share that with the team? Because obviously everyone's under a lot of pressure and a lot of stress.
Yeah. I think the thing that has kept me grounded are the people that surround me. It's hard being in this role because you're expected to be the person who's always positive, always the cheerleader, always championing, always, and doing all these things. And I think to the best of my ability, I've done that. But I've also had plenty of the moments where I've been vulnerable with my team. I've cried in front of my team and said, like, I can't, like, this is too much for me right now. And they've stepped in and been my shoulder to lean on, just in the same way that I've been the shoulder for them to lean on when they needed me. So
Mm,
in terms of grounding, it's the people. It all goes back to that, surrounding yourself with the people who can catch you when you fall or trip. And I've needed them along the way just as much as, they've needed me, I think. It's very
mm.
symbiotic.
Very fascinating. Just what's when I think about mistakes, I think about learnings. What's the best mistake that you made in this role so
Oh,
far?
um, there's plenty of mistakes. Best one though, that's a tough question. I mean, I've had I've made the mistake of hiring people who I thought were exactly the right fit, and then they weren't. And then I've
Mm,
had to go through the process of coming to terms with that and not coming to terms with it because I thought, oh, well, I hired them. So of course they're going to be great. It had nothing to do with that. But I really languished in the sentiment of the humanity around the situation because I had done all the work along with my team to recruit somebody there and now it's not working. So
mm.
how do we either make it work or how do we facilitate an exit that's, dignified and things like that? And I can't say that I've perfected that either, but anytime we've faced a situation like that, it's taught me a lot about what I would do to make it better the next time.
Yeah, one thing's for sure is you've gotten a lot of reps at having really difficult conversations.
Yeah.
So if there's any
Yeah.
training, it's like you can't learn that from reading a book. That only happens in like real life,
Yeah.
where really high stakes moments. So you've obviously have gone through that and will continue to, hopefully go through that less as you continue to gain wisdom and all that stuff. But how do people follow you, follow the work that you and the team are doing? Maybe kind of give people a little bit of a shout out just for those that are, you know, spreading some love on the rural folks. Let them know how they can kind of connect with you and stay in touch with you.
Yeah, definitely. I mean, we, of course, are present on all the social media platforms you can think of. Facebook is definitely our most active one, seems to be the fan favorite for people in our area. We have a new website in the works, which we're really excited about, that'll also serve as kind of a community resource hub. So we're pumped about that. I'm, of course, present on LinkedIn and try and share things from our company's page to keep people updated. And honestly, having opportunities like this to come on podcasts and things of this nature have helped tremendously. Our facility and our system has gotten way more press um, since I started because it kind of started as the spectacle of like, oh, here's this 22-year-old CEO. And I think everybody was kind of holding their breath like, oh, is he going to fail and are they going to close? Like, what's going to happen? I think a lot of people initially subscribed because they just wanted to see what was going to happen with us. Was this going to work? Is this so crazy that it would never work and things like that? And then fortunately, invitations like this one kept coming kind of after the cooling period of
Right,
everybody biting their nails and
right.
waiting to see what happens. And this has given a great platform to us too to talk about, who we are as an organization, what we do, why we do it, how we do it, and things like that. So uh, there's quite a few episodes out there now, and I hope this is one of many that people choose to listen to hear about us and who we are and what we're doing. So,
Aiden, it's been great. Before we wrap, I just want to say this that I appreciate your rigorous honesty. Going into a seat like that of that level of importance, and even just saying, "Hey, I'm 22." Um, you kind of went in really humble, and I think sometimes when you get a chance to sit in that seat and you got people that are around you that are much, much older. In fact, a lot of people, you could have been their kid and now all of a sudden you're the boss. There's a level of sensitivity that you have to approach things with. And the fact that you approached it in the diplomatic type way that you did shows a lot about your leadership style. And, for those that are listening, maybe that's you. Maybe you're running into a situation where you are in a seat and maybe some of the people that report to you are a lot older. Um, like this is a great example of what it can look like and how the turnout can be really, really positive.
yep,
So, and also just that, you weren't performative here. You kind of shared some of the wins and also just being very transparent about, hey, we haven't figured this whole thing out yet. We had to hire six directors of nursing in this time span. Like, we're going to be making mistakes, but you're I'll just say you're tempering it. You're managing expectations appropriately. And I think as a leader, probably the best thing that you can do is to manage expectations because expectations sometimes inadvertently move into and shift into entitlements. And that's not a great place to be in. Um, so interesting to hear about that. So for those, if you want to hear more, please, if you don't mind, share this episode, like it, comment, subscribe. Those are always helpful things. And if there is a topic that you want us to explore, or even a leader that you'd like to hear from, drop me a note, leave us a comment. Again, this platform, it's really about community. It's not just content. It's an interactive, living, breathing ecosystem. So thanks for listening. Keep building with purpose, keep leading with purpose, and we'll see you next time on the Advancing Healthcare Innovation Show. Thanks, Aidan.
Thank you.